Assalamualaikum warahmatullahi wabarakatuh. Today, we are going to present to you about heart transplantation. This is our group members. Nur Adawiyah, Sarah Fahimah, Rabiatul Syahirah, and Ainatul Nabiha. Problem identification. Heart is designed as a muscular pump to push blood around the body. Heart failure is a condition where the heart cannot pump enough blood to match what the body needs. A heart transplant is typically required for patients with end-stage heart failure or severe. There are few conditions treated by heart transplantation: cardiomyopathy, arrhythmia, heart attack, diabetes, and coronary artery disease.
Islamic view of heart transplantation. Yuridullahu bikumul yusra wa la yuridu bikumul usra. Allah intends for you ease and does not intend for you hardship. Organ transplant is permissible in order to protect the life of humans, which is a commandment in Maqasid al-Shari'ah, which is the objective of Sharia.
Okay, so right now we will focus on anatomy and physiology of the heart. I will explain it into three parts. The first part is deoxygenated blood. The parts that carry deoxygenated blood including superior vena cava, which functions to return deoxygenated blood from upper body to right atrium, and secondly, inferior vena cava. The inferior vena cava return deoxygenated blood from lower body, and lastly, pulmonary artery. Its function to return deoxygenated blood from right ventricle to lungs. And we will focus on oxygenated blood. The parts that carry oxygenated blood is aorta and pulmonary vein. Aorta functions to carry oxygenated blood to all parts of body, and pulmonary vein, it will carry oxygenated from lungs to the left atrium. And lastly, the valves. Heart contains a lot of valves, including tricuspid valve, bicuspid valve, and the function of the valves is to prevent backflow and to prevent the mixture of the blood. So, we will focus on the importance of heart in maintaining homeostasis. It will have three importance, and first one is circulation and oxygen delivery. Systematic circulation supplies oxygenated blood and nutrients to tissues. And secondly, waste removal. Blood flows carries metabolic byproducts like urea and CO2 to the kidneys and lungs for excretion to prevent toxic buildup, maintaining chemical stability. And lastly, the importance is to regulation of blood pressure and perfusion. The heart generates pressure gradient needed for blood flow. Adjusts cardiac output depending on activity to ensure we receive enough oxygen.
Next, I will explain how a heart transplant is performed. First is preparation. The patient is given general anesthesia, so they are fully asleep. Then, the surgeon opens the chest through a procedure called sternotomy. Next is minimal circulatory support. The body tries to maintain natural blood circulation. However, temporary support like ECMO may be used if needed. After that is removal of the diseased heart. The damaged heart is removed quickly. The time without a heart must be extremely short to avoid complications. Then comes implantation of the donor heart. The donor heart is carefully connected to the major blood vessels, including the left and right atrium, the aorta, and the pulmonary artery. Next is activation of the new heart. Blood flow is restored and the new heart starts beating. Finally is stabilization. The patient's blood pressure and oxygen levels are closely monitored. There may be higher risk because full machine support is not used.
Physiological adaptations after transplantation. First, increased resting heart rate. The recipients typically have higher resting heart rate due to loss of vagal innervation after denervation. Secondly, slower heart rate responds to exercise. Heart rate increases more slowly during exercise and peak heart rate may occur later, since it depends on circulating hormones rather than direct nerve signals. Third, limited and incomplete reinnervation over time. Some nerve regrowth can occur years after transplant, but it is usually incomplete and regionally limited. Lastly, altered exercise capacity and chronotropic incompetence. Denervation results in a reduced ability to increase heart rate during exercise, which affects exercise tolerance.
In summary, heart transplantation is a formative surgical intervention that bridges advanced physiology with ethical permissibility. By replacing a failing pump with a healthy donor organ, we not only address the mechanical needs of the body, but also fulfill the higher objective of Sharia to protect and preserve human life.